What is a herniated cervical disc? Have you been told or diagnosed with a cervical herniated disc and you just don't know exactly what that means? I will answer that question immediately in the next few seconds. This video is for people who have been diagnosed or told that they have a herniated cervical disc and they are feeling pain and other symptoms caused by this. And they don't know what exactly that means and if it can get better. So keep watching. Now, the reality is that your body has the innate ability to heal itself. And so it can start to heal a herniated cervical disc within about a 6 to 8 week period. Now, if this is something that's been affecting you and has become chronic, meaning you've been dealing with it now for a 6, 9, month, 1 year, 2 year period, and now you've gone to the doctor and the doctor is saying to you, yeah, you have a herniated cervical disc, but they don't give you much more information than that. You're left wondering, what is a herniated cervical disc and am I going to be stuck with this for life? I have been seeing many patients with this exact question and problem since I graduated from chiropractic school in 2016. I'm a corrective care chiropractic doctor working in Newmarket, Ontario, Canada. I've been certified in Thompson technique, Webster technique, and I have done extensive studies in chiropractic biophysics. My name is Dr. Kristina Turkewitsch, and you can check out many of my other videos where I share my knowledge working in clinical practice. And all the tricks and tips that I provide from that knowledge that can give you information about maybe some of the symptoms and issues you've been dealing with. One of the most important things you need to know is that a herniated cervical disc can get better. It can be helped, and healing can be accelerated by seeing a corrective care chiropractor, because that's what I do. I focus on the health of the spine and I can help it get better. So I've got my little spine here, and so I want to talk to you about exactly what is a herniated cervical disc. So first of all, the spinal discs in the body are right here, and they're composed of two different things. So first of all, they have a soft or softer center, like squishy center. So these discs here, okay? And then they're surrounded by a fibrous ring, okay? A fibrous tissue ring that goes around the outside. Now, when a herniation happens, that softer bit in the center gets ruptured out through the outer wall. And a good kind of common, example of this is when, you squeeze kind of that jelly substance out of a jelly donut and it squeezes out the side. It's a very similar thing that occurs. Now, when this happens, when the soft center gets protruded through the outer ring, it can actually put pressure on the spinal nerves that exit on either side of the spine. So these little nerves here that come out the sides, they can start getting pressure on them. And this can start to cause pain and it can start to cause radiculopathy. If you have a herniated cervical disc, you're dealing with a disc in the neck. So this is called the cervical spine. There are 7 cervical vertebrae that make up the cervical spine, and they are separated by the cervical discs. A herniated cervical disc can be caused by something like a really traumatic physical impact, like a car accident, and so that can rupture the disc. However, this is not that common. The more common type or way that you can get a cervical herniated disc is by a repetitive trauma over time that changes the posture in the neck. And so when the posture of the neck changes from maybe more of a C-shaped curve, which is the normal curve, to a more straight neck, which is very common in our society now. That puts a lot of pressure on the discs that they aren't really able to handle. And so when that occurs, what can happen is that all of a sudden, without really any significant reason, you would start to have pain in the neck and radiculopathy and inflammation that starts to happen. And it can start mild and then usually gets worse over a few days. If this is you, symptoms can persist for quite a while. And like I mentioned, it can start to heal within about a 6 to 8 week period. However, this is really the best case scenario. But for many people, this is not the case. And symptoms can persist for a very long time until it becomes a chronic state. And you have pain in the neck, numbness and tingling that go down the shoulder, down the arm, into the hand, and it can just really stick around for a very long time. This is usually the case we see a lot of. Some patients of mine have been dealing with this for a very long time, and they were told many times by many different doctors that they would have to deal with this for the rest of their life. Or the other choice is get surgery, but that can come along with a lot of other issues and risks that you don't really want to have, and not usually are they all that successful. Now, the good news is you do not have to live with a herniated cervical disc. Let me just tell you about a patient of mine. We'll call him Max. And so Max came in a number of years ago, and that's what he had. He had a herniated cervical disc, and he had been dealing with this for about 2 years now. So it had become chronic for him. And it wasn't, as intense as it was at the beginning. However, the symptoms were still there. They were still really bothering him. His symptoms included, right-sided neck pain, shoulder pain, arm pain, numbness in the shoulder and into the hand. And he was told by his doctor that this is just something he would have to live with, and that, manual therapies could probably help him manage it a little bit, but it's just something that he would always have and always have to deal with. Now, one day he came into the office and he said to me, "Doc, this is amazing. I just woke up today and I have no pain. This is the first day in I don't know how long that I don't have any pain. Isn't that awesome?" I had just been seeing him for, a few weeks at this point, and already he was starting to feel the effects. So we put him on a corrective care plan, and he was already starting to feel the changes. It was awesome. And so I continued to see him, over the next while. And by the time we were done together, he was completely out of pain and it didn't come back. He was just dealing with this thing for so long. And he was just so amazed that at the end of treatment, his pain was gone. And this just seemed really crazy to him. He's like, "I can't believe this. I was told that I would have to live with this for the rest of my life and I just have to deal with it." He's like, "But this is done. It's gone and I can't believe it." So if this is you, please don't hesitate. Act now. Please get in contact with me. If you are in the area, you can come in and get an assessment here at my clinic. Or if you're not, in this general location near Newmarket, Ontario, Canada, please contact me and maybe I can find somebody close to you, a corrective care chiropractor that can help like this and help to heal your herniated cervical disc. A herniated cervical disc does not have to be a debilitating lifetime situation. If you have found this valuable, please comment below. Let me know what you've tried that's worked and what you've tried that hasn't worked. Let me know the struggles that you've been having with a herniated cervical disc. And go take a look at my next video. I'm gonna put it up on the screen here. It is my top 3 exercises for neck pain and tension. And I really feel that this video would have value for you, especially if you're in this situation, because it can really help maybe mitigate some of those symptoms you've been having until you're able to see someone to help you. So go check it out right now.